All right, everyone. Maximilian Kurscheidt is presenting on the International Patient Summary Challenge. And yeah, I'm very thrilled to hear this talk. So not only because he has the same name as me, but the stage is yours.
Thank you very much. Welcome to my talk. I'm presenting today about the International Patient Summary Challenge, which we performed with student groups from the University of Heilbronn and the Universidad Chile in January this year. So pretty fresh, and therefore I'm really excited to present you some lessons learned from that challenge. Just a short introduction. I'm a research assistant at Heilbronn University, and I'm working in the Medical Informatics Initiative in the project called Data Sharing Framework Community. There will be a talk on Friday morning from my colleague Hauke. So if you're interested in to learn more about that, then feel free to join there. I'm the third time on FHIR DevDays, but it's my first time presenting, so I'm definitely hyped about that. So just that you can meet the group. There were 20 students joining us in the challenge, and we had more or less one example FHIR implementation guide, which I will present, and 5 medical use cases, which the students worked jointly on. And we had always like 2 Chilean students and 2 German students working together on one use case. So we had a couple online meetings and virtual meetings where they started working together, and then we met up for like an intense workshop week in Chile for 5 days in January, where we basically brought all the ideas and aspects together, and we were able to hold a symposium about bridging borders and talking about international patient summary and the aspect of migration between countries, and also were able to present our results on the FHIR Connectathon from the HL7 Chile group. So that's like the surroundings. Basically the goals from the IPS challenge were that we try to experiment how valid and good the IPS is in comparison for cross border use. So because Chile and Germany have completely different healthcare systems, that was interesting for us to see how that is working out, and also to identify the interoperability challenges coming with that. The students developed some prototypes. I will show some screenshots later, and then we will they were able to present that and in kind of like a poster session in front of the faculty there. So I think that slide is quite important because we are seeing more and more migration happening. So citizens crossing borders, starting to live there, to work there, but they kind of have already medical records in their home country or in their prior healthcare systems where they were based in, and that's something which I think we need to always keep in mind, that we will have that more and more happening, that people switch countries, live abroad, work abroad, and they need to maybe bring their medical record with them. And I think the International Patient Summary is quite a nice tool for doing that, because it's standardized collection of clinical and contextual information, and it has the goal to be minimal and non-exhaustive set of basic clinical data of an individual patient. So it obviously, because it's a summary, it always is a snapshot of a patient and their current clinical status, but it also involves some speciality uh, aspects which are implemented in the IPS, and it's designed to be simple and implementable for a lot of implementers. So what we started with, and my colleague Stefan and Alonso, they mainly implemented an example implementation guide with 192 FHIR resources for 5 patients for the 5 use cases, and we that was like the starting point for the students to basically interact with FHIR servers, interact with the resources, and have like a certain use case and description about, okay, why should I use the international patient summary for my use cases then. So there are always like descriptions about either a Chilean citizen moving to coming to Germany, having a medical emergency, and or a German citizen coming to Chile. So that was the basic use case. And for all of that, we developed different resources for earlier diagnosis, earlier encounters, medications, and other measurements. So if we are looking into the use cases and the applications the students developed, we had the hypertension use case. They focused on building a smart on FHIR application and basically integrating, like building an application which can be extended through for other resources, which were maybe not necessary for the hypertension use case. They worked quite a bit with the medication coding systems in SNOMED and RxNorm and integrated their APIs in it. And they developed like an automated and offline free text translation, because I think that's also like a big challenge to if you cross borders and there might be language barriers at that. The second use case was food intolerance, and that group developed like a dashboard which connected a knowledge base with the international patient summary patient data. And they differentiated between food allergies and intolerances, which was not that clear in the beginning. And especially they worked with terminology integration like the Loink API and the SNOMED browser. But they also found out that the translation capabilities are a little bit limited still in the coding systems. Then the third use case was the surgery use case, and that group tried to present like the medical history of a patient who had an accident and visualized encounters additionally with pictures which we integrated into the IPS. But the IPS is not designed for actually storing images. So we did a little bit of a workaround there. And but the question arises, how do we deal in generally with images or other data which needs to be pulled maybe afterwards when a patient has like an emergency, because these images might be really relevant for addressing like a surgery or something like that. The fourth use case is the diabetes use case, and they focused really strongly on visualizing the medical histories in a timeline and showing also like their data over like a longitudinal timeline. That group also focused on retrieving the IPS resources through the composition resource, whereas the other groups mainly went directly to the resources and fetched them from the file server. And that group also thought about, okay, how can I, as a patient, provide access to like a healthcare professional in a different country? And they thought about, okay, we can use a QR code and develop like a workflow where they provided like access to their personal health record or to their IPS. And that process also included like a consent process. Then the fifth use case was an asthma use case, and that group went a little bit a different route and tried to build like a more generic application to visualize the IPS data set, and trying to be as interoperable as possible. So their approach was, okay, if I don't know that resource, I will just show the JSON or XML, and I can still provide access to like a physician with that data, even if the use case didn't included that kind of resources. And they also implemented quite a couple APIs to different systems, like an better API or terminology services, and that was interesting to see how all these 5 applications and demonstrators went different routes and used the IPS in their specific way, but with like a different focus. So to summarize a little bit, the IPS challenge was a really great success, and especially that the students were able in a really short time to develop 5 functional demonstrators, which could also be further implemented or be based on, because some of them are open source and accessible through GitHub. Then we learned that that challenge as a methodology to work with students on like a real problem was really successful, and it was great to bridge that gap between interdisciplinary and multicultural teams, that they were working on the same aspects. So what is, I think, the really great value of the IPS is that it allows heterogeneous implementation approaches, and it also allows to use the IPS for different contexts, for different target groups, depending if you are developing like a generic or a specific IPS viewer or application, or if you want to add resources to an IPS, or if you just want to view them, and to have that example IG with use cases that other people can maybe also base their applications on and test applications with, was quite helpful. And sharing data across borders, as we heard in the talk before, is not that easy, especially when we have to think about how to give access to servers which are located in different areas. That's something which I think requires connected, interoperable infrastructure coming across with that. And I'm happy that I learned today about the IPA implementation guide, which I think tries to solve exactly that problem. There were obviously a lot of like interoperability challenges, which I addressed already a little bit, but there are local terminologies that were not basically mappable and also sometimes not accessible for the IPS. Then we had translation problems with medical codes and especially descriptions or free text, which was not automatically translatable, or the German translation for SNOMED was not that far ahead at that point. And providing the IPS data and give access across healthcare systems is not that easy, especially if you want to think about authorization and authentication. And also it's relevant to discuss where the data is located and stored. And that really strongly depends also on the use case. So if you're carrying your IPS with you on your phone, or is it stored on a FHIR server, which is maybe accessible in only one country or in some countries. Yeah, I think we have to think about how to gain access to further resources which might be connected to the IPS or might not, but are relevant for things. And I think validation of resources and terminologies in the case of IPS, but in general, I think is like a problem and challenge which we face quite a bit. So thank you for your attention, and yeah. I think I went a little bit over time, right?
All good, all is good. That was a very nice talk on 5 different use cases. Do we have questions on one of them? We do have one question over there.
So I think this is really great. You and I have had a chance to talk with it a little bit earlier, a few weeks ago. But I am curious about a couple of things. There's a lot of questions I could ask, but this is done as an academic exercise, basically trying to simulate what it would be like to exchange this data between Germany and Chile and all of that. And I don't know if you have any thoughts about what it would take to actually make it a reality in that situation if you were actually doing that cross-border travel between the two countries. And one particular aspect I was thinking of is, you mentioned in I think the last slide or two about the local terminologies issue, and both in Germany and in Chile, there might be a lot of use of local codes. I think there was also mentioned that SNOMED and LOINC were kind of assumed in some of the things, but that might not be the reality on the ground if people are genuine. And so how would you deal with that, and how much might you rely on, say, the narrative text, but that would be in different languages, and just some of those aspects.
Yeah, thanks for the wide variety of questions and topics you addressed there. I think a lot of them we kind of faced as well, that there are challenges which are not that easily solvable now. But I'm hopeful that it will get better, especially when we have local FHIR servers, IPS apps, which a patient can really get their summary accessible. And if a patient gets that data accessible, he or she could basically start sharing it as well. So then we just have to think about, okay, how do we give access to that data which belongs to you and which you control to like a healthcare professional in an emergency situation. But then we haven't solved the issue of how to integrate that data again into local systems, into local environments, and especially if we talk about migration, we want to have basically all that data coming more or less into my new healthcare system or to that healthcare provider. And I think it's really important that we are not only thinking about the International Patient Summary as an specification for defining the medical concept in there, but also thinking about the IPS in terms of how do we set up a network of infrastructure that can talk with each other, that can share and exchange IPS data, and where maybe that mapping between code systems and also languages are maybe handled in certain places, and the infrastructure aspect, I think, is pretty important. Did that answer a little bit the questions? Or
very good, yes.
Okay, thanks.
That was a broad set of questions.
It was, yes. Are there any more questions? If no, then thanks, Rob, for asking questions for all of the audience. And thanks, Maximilian, for this great presentation. All right, so I think there will be a little break now, right? In this break, please fill out the feedback and see you next talk.
Thank you very much.